Millions of women across the United States suffer from a condition most are too embarrassed to talk about, even to other women. It's called stress urinary incontinence.
Stress urinary incontinence is defined as the leakage of urine with a stressful event. And that happens because the pressure in the bladder exceeds the pressure in the urine tube.
I never knew that there was anything that could be done about it. There was nobody that I could talk to.
Stress urinary incontinence is the most common type of urinary incontinence for women in the U.S.
About 1 in 3 women will experience urinary incontinence of some sort, being the majority of those being stress incontinence.
I'm going through this situation, and how can I talk to my husband about this? Will he look at me differently? Will he see me, differently? I think that was one of the biggest concerns for me.
SUI, or stress urinary incontinence, which is the uncontrollable loss of urine, can affect women after childbirth and may progressively get worse over the years.
Many women say, I can't play with my kids, I can't pick my children up, I can't run in the yard with them, or do these physical activities without leaking urine.
We began to laugh, and I just completely lost it. So in front of about 10 people, I had wet underwear, wet pants, and that was quite embarrassing. I had to run out. Everyone got to see what my pain was that I lived with every day.
I'm Dr. Scott McFarland. Join us as we take a look at some of the advances doctors have made in giving women a better quality of life without the embarrassing fear that surrounds stress urinary incontinence. That's coming up on Healthy Body, Healthy Mind.
Major funding for Healthy Body, Healthy Mind is provided by Novartis Pharmaceuticals Corporation, whose mission is to improve people's lives by pioneering novel healthcare solutions. And by Baxter. And by Janssen Pharmaceuticals, dedicated to addressing and resolving the major unmet medical needs of our time, driven by our commitment to patients, healthcare professionals, and caregivers to advance patient care. And by Genzyme, whose mission is to discover and deliver transformative therapies for patients with rare and special unmet medical needs, providing hope where there was none before. Additional funding provided by American Medical Systems and by Celgene.
Female stress incontinence is the most common form of urinary incontinence affecting women today. It is also very treatable. However, many women feel it is too personal and embarrassing a subject to talk about and feel uncomfortable even discussing it with their doctors. So oftentimes, many women change their life to accommodate their incontinence, preventing them from living full and happy lives.
Oh, it's beautiful out here today.
Meet 67-year-old Pennsylvania resident Gussie Zalagowski. Gussie loves spending time with her family and being active. However, for many years she suffered from stress incontinence, which slowly prevented her from enjoying many precious moments with her family and friends.
I was losing out on a lot of things, a lot of fun times. The family would go out into the ocean and they would be splashing and playing, and it just got to be such a problem that it prevented me from doing my everyday normal things. I would always feel self-conscious about things.
Dr. Thomas Gadice is an obstetrician gynecologist at South Carolina Obstetrics and Gynecology Associates with a specialty in female pelvic medicine and reconstructive surgery.
Good morning, Mitzi.
Good morning, Dr. Gadice.
Dr. Gadice is also a clinical professor at the University of South Carolina School of Medicine.
Stress urinary incontinence can cause a significant decrease in quality of life, and mainly because it affects the interactions with the outside world and with our friends and colleagues and neighbors and loved ones that can socially isolate an individual.
And there are many socially isolated women suffering with stress urinary incontinence. About 1 in 3 women will experience urinary incontinence of some kind, with the majority of those cases being stress incontinence. At the Female Pelvic Health Center in Newtown, Pennsylvania, Dr. Stephanie Molden is a urogynecologist and a board-certified OB/GYN who specializes in pelvic organ prolapse, incontinence, and minimally invasive surgery related to these areas. She is also the founder of the Female Pelvic Health Center in Newtown, Pennsylvania.
A woman who has incontinence learns to avoid things, and sometimes that means avoiding things that are fun things or things that we all enjoy on a regular basis and don't think about. But women with incontinence think about it a lot, and I hear it every day that they avoid going to the gym or doing that Zumba class they so much enjoy, or dancing.
If I would go to the mall, I knew where every bathroom was. I would lose sleep at night because I would have to get up 3 or 4 times during the night to go to the bathroom and couldn't get back to sleep. And I would get up very early to go to work in the morning.
So what exactly happens in women who have stress incontinence? Dr. Robert D. Moore is the Director of Advanced Pelvic Surgery and co-director of urogynecology with International Urogynecology Associates of Atlanta and Beverly Hills.
In the normal female bladder, it's supported by the anterior vaginal wall. This actually is part of the pelvic floor support of the bladder. This helps it keep it in position. This helps it function correctly. Specifically, as far as continence is concerned, the muscle itself, which is called the detrusor muscle, the bladder is actually made up of this muscle. That muscle relaxes as the bladder gets filled, and the urethra, which is actually the outlet of the bladder, that stays contracted while the bladder's filling. So in a normal everyday life event, as you go through your day, you drink fluids, you go about your normal daily activities, the bladder's filling, there shouldn't be much of a sensation, so the bladder's filling, the urethra's contracted, and when it gets to a point that it's full enough, it sends a message to our brain and it says, I'm starting to get full. It's time for me to think about heading to the bathroom.
But for those suffering from stress incontinence, the normal bladder function is disrupted by physical stress to the muscle.
So in everyday life, if a cough occurs and the bladder gets squeezed, the pressure needs to increase here so it doesn't leak out. We need more resistance here. In the normal female anatomy, there's a ligament that sits right up underneath the urethra there. And that ligament gives that support. The ligament's attached to our pelvic floor muscles, the Kegel muscles per se. And so as that cough occurs, subconsciously the muscles tighten, it tightens the ligament up, and it gives more resistance at the outlet so a leak doesn't occur. If that ligament gets stretched or torn, the bladder can drop some, and also then you don't have the resistance. The muscles may be strong and they can pull the ligament up, but it's not tightening up underneath the urethra to prevent that leakage. So that's what we call stress incontinence.
For Gussie Zalagowski, she started to see a change in her normal bladder function right after she gave birth to her 3rd child.
I noticed I had a little dribble when I would laugh. And I just thought it was a normal thing, an everyday thing that would happen when you got a little bit older. I was only 26 at the time, but I just thought, you know, basically this is what happens after you have a baby and it'll go away. It never went away. It just kept getting worse.
Stress urinary incontinence is a condition that waxes and wanes. So it may actually be very mild when you're younger, and as you age, because of the natural changes that happen to your body with age, it may get dramatically worse.
Female stress urinary incontinence can affect women at any age, Although it is seen more frequently in the older population, the symptoms of stress incontinence can start in young women in their childbearing years. In fact, women who have had vaginal childbirths are at an increased risk to develop stress incontinence.
So we've been seeing you about a year now.
The term urinary incontinence is an umbrella term for an array of different types of incontinence, including stress incontinence.
One is called urge incontinence. That's the one with the overactive bladder that can be more common in our elderly population. Stress incontinence is physical activities like laughing, coughing, and sneezing. Typically, that's an anatomic issue or a loss of support of the bladder or the bladder support or the urethral support. And then we have what we call mixed incontinence. And many women suffer from a combination of both stress and urge.
So stress urinary incontinence is incontinence that occurs with any pressure on the bladder, any stress, the stress referring to the pressure. And so that can occur with a cough, a sneeze, lifting, exercise, things like that that put external pressure onto the bladder itself. And the maintenance of continence is then compromised in patients who have this disorder, and the urine is unable to be held into the bladder and is able to leak out.
Good morning, baby. I know where you were last night.
Natasha Holt is an active young mother of 6, living in Atlanta, Georgia. When Natasha is not taking care of her family, she enjoys working as a background vocalist for recordings.
Don't wanna fight, no.
After the birth of her 6th child, Natasha started to notice that her stress incontinence became so bad it was even difficult for her to sing without having an accident.
If I'd have to hold a note, like, for example, if I'm singing, if I had to hold a note for a long time or have to really use force, while I'm singing, there'd be sometimes an accident. Or if I'm, playing with my kids for a long period of time, then I'd notice an accident, or even a coughing or a laughing, I'd notice little incidents here and there.
Experts say that although the degree or severity may vary from patient to patient, there are certain risk factors that are associated with stress incontinence.
Certainly as we age, it's more common. Stress incontinence occurs approximately, about 20 to 30% of younger women, and as we get older, it goes up to approximately 50%. So it does increase as we age. So overall, it's about 1 in 3 women will experience this. Much more common after normal childbirth. So a vaginal delivery and more vaginal deliveries does promote urinary incontinence, as well as other pelvic floor disorders. Certainly women who are at risk would be someone who has asthma, COPD, anybody who has strong coughing or has a job with a lot of lifting. Anything that's going to put a lot of pressure onto the bladder and pelvic organs is more at risk for this condition. Smoking is a risk factor as well.
You'll hear those funny noises. They may sound a little different.
Palmetto Health Heart Hospital in Columbia, South Carolina, is where you'll find 60-year-old Mia Simmons. Mia is a vascular quality coordinator and a vascular sonographer. Mia also suffered with stress incontinence for most of her adult life.
I have a tendency that when I would walk outside from a dark place, work, I would be driving and the sun would make me sneeze. And then I would start to leak. And it progressively over time became worse. Then I started noticing laughter. When people would start to laugh and I would participate, I would start to lose control then also.
Mia's stress incontinence slowly became worse over the years, to the point where it affected her quality of life.
I love to do horseback riding. I'm an outdoors kind of person, but just trying to get on top of a horse and pulling it would make me urinate. So I'm not going to ride a horse if that's what was going to happen. I like to swim, but jumping into the water or doing any of those kind of things would make you want to urinate. I didn't have really a life that I wanted. The incontinence dictated what I did with my life.
So this is a huge problem. However, it's also a very personal problem, and it's also very embarrassing. So even if you're with 5 friends and you're a woman, and 3 of the 5 of you are leaking urine on a daily basis, you might not talk about it at all because it's very personal, it's embarrassing.
Mia remembers a moment at work where she lost control of her bladder.
I was actually in my office and we began to laugh and I just completely lost it. So in front of about 10 people, I had wet underwear, wet pants, and that was quite embarrassing. I had to run out. Everyone got to see what my pain was that I lived with every day.
And Mia is not alone. Women with stress incontinence usually alter their life to accommodate their condition.
They may change the color of their clothes, wear dark clothes, wear just black pants, that sort of thing, because they're that worried about having an accident in a public place that may be very embarrassing to themselves or to their family or their friends they may be with.
So patients oftentimes will restrict their activities. They'll not want to go out and discuss this condition, or at times even want to leave the house because of an embarrassing condition that they're afraid others may find unacceptable. And so oftentimes that embarrassment can lead to patients becoming depressed or decreasing their active lifestyle or even interpersonal relationships with a special person or friend.
Every woman wants to have like a level of sex appeal to their husband or their spouse or their partner, and I felt like that I was robbed of that, or that kind of took that away from me. Like, I'm going through this situation and how can I talk to my husband about this? Will he look at me differently? Will he see me, differently? I think that was one of the biggest concerns for me.
Stress incontinence can become so severe, women may experience depression, and they may shun social interaction or map out bathroom locations when they do venture out. The good news is that many women do not have to live life with such restrictions. That's because physicians around the country are shedding new light on treatment options that may prevent the uncontrollable and oftentimes embarrassing effects of stress incontinence. Coming up, we'll take a look at the latest treatment options available for stress incontinence and how these options are giving women the freedom to live life as they once did. Did you know that athletes such as runners and gymnasts are at a higher risk for developing stress incontinence due to the increased pressure that is often put on the pelvic floor muscle?
At this point, do you have any remaining symptoms? A lot of women feel like this is something that's inevitable, that this is part of a normal aging process. I hear that a lot, that they just thought it was something they had to learn to deal with because their mom and their friends have it. And until someone gets frustrated enough to seek care and learn that there are options to actually treat this, I think they just expect it.
Women can speak with their primary care physician, who may refer them to a urologist, a gynecologist obstetrician, or a urogynecologist, who focuses on pelvic disorders and can identify stress incontinence.
We find out specifically what are you doing to cause, or when you have urinary leakage, what is happening. And that's how we can usually determine just by history, is this bladder control issue or is this stress incontinence? So if a woman says, I leak urine when I primarily am laughing, coughing, sneezing, exercise, jumping, I can't do kickboxing, even walking or hiking or lifting or straining. Immediately we're thinking this is stress incontinence. And then we talk about the bladder control issues.
To confirm the history, doctors may try a simple test in the clinic during a visit.
Having the patient come in with a full bladder, and we simply do what's called a cough test at the time of her exam. So we have her bear down, strain, cough, maybe in the lying position, sitting position, or standing. And if she leaks with that cough, we've just demonstrated stress incontinence.
Once a diagnosis is made, doctors will offer an array of options, from the least invasive to surgery, depending on the severity of the patient's condition.
A lot of women are surprised to find out there are treatments for incontinence in general that work. and that can actually get rid of the problem. So I think it's a big misperception that women are expected to have leakage at some point, an incontinence of some sort, rather than it being an actual abnormality.
I lived with this for so long, it just got to be a point where I didn't think there was anything I could do about it. And then when I went to the doctors this past December and he told me there was hope, then I said, this is for me.
There are many treatments available today, fortunately, for stress urinary incontinence, and they're highly successful. And treatments range from many things that can be very conservative to lifestyle changes, to medical devices that go in the urethra or the vagina to give continence, to pelvic floor muscle exercises or other things that women can do. If these types of less medical type of developments don't correct urinary incontinence, there are very good minimally invasive surgical procedures that can be performed. The most common and the probable most successful procedure that we have today is called the sling procedure.
A sling procedure is also referred to as a mesh tape procedure.
Many women now hear the word mesh and they think that I can't have surgery, I don't want that surgery, I'll just live with my urinary leakage because I don't want to have, if the FDA puts some sort of safety notification out about this, this must mean that these procedures have been recalled. There's a lot of misinformation out there about that. What the FDA deemed was that mesh tape slings, like the ones we're talking about for urinary leakage, they felt that they were safe, they were effective, nothing was pulled off the market, there was no bans on the slings for urinary leakage. We're able to make one little incision, we would put the sling in, it had to come out through a couple little incisions in the abdominal wall, but we would then waken the patient up from our anesthesia, have the bladder full, and she would cough, and we would adjust the sling until she didn't leak with a cough anymore. So it was almost personalized to her. And this has really become the gold standard of treatment for urinary leakage in women.
Gussie, Natasha, and Mia all had the sling procedure and say they quickly saw the results. Their stress incontinence problems were gone. Gussie says she got her life back and has begun taking yoga and Tai Chi lessons.
It has given me so much freedom to know that I could go anywhere, be at any place, wear any color I want. It just has made me so happy. I do more things, I'm more active, I've joined more classes at the Y. When I do my walking, I just feel free.
After her sling procedure, Natasha gained more confidence performing by not having to worry about an incontinence accident.
I don't have to be concerned about if I'm going to have an accident or, if this involuntary thing is going to happen, while I'm performing. And it's definitely been a confidence booster.
As for Mia, she says she's living life to its fullest and doing things she never thought of doing before.
I went horseback riding. I wouldn't have been able to have gotten on the horse before. I would have been humiliated at the time. I climbed on that horse and I rode that horse up the mountains and I rode them down the mountains, slid down very, very narrow rock. I didn't have any problems whatsoever. I planned to dive out of a plane. Life is wonderful now. Life is very, very good. I have a life now.
Women who find they are losing control of bladder function during certain physical activities such as running, laughing, or coughing just might have stress urinary incontinence. But today, they often don't have to endure the uncomfortable and embarrassing consequences that come with this condition. Instead, speaking with their specialist to discuss possible treatment options might be the first step in getting their lives back to normal. That's it for this edition of Healthy Body, Healthy Mind. I'm Dr. Scott McFarland. See you next time. If you'd like to see this program again or watch any of our other Healthy Body, Healthy Mind programs, please visit our website at hbhm.tv. To answer any specific questions you may have, be sure to contact your healthcare provider. To comment on today's program, please call 888-380-6500 or email hbhm@itvIsus.com.
Major funding for Healthy Body, Healthy Mind is provided by Novartis Pharmaceuticals Corporation, whose mission is to improve people's lives by pioneering novel healthcare solutions. And by Baxter. And by Janssen Pharmaceuticals, dedicated to addressing and resolving the major unmet medical needs of our time, driven by our commitment to patients, healthcare professionals, and caregivers to advance patient care. And by Genzyme, whose mission is to discover and deliver transformative therapies for patients with rare and special unmet medical needs, providing hope where there was none before. Additional funding provided by American Medical Systems and by Celgene.